A new COVID-19 cluster has been detected in Kuala Lumpur, which has 3 confirmed cases and is linked to a restaurant in Titiwangsa. Health Director General Tan Sri Dr. Noor Hisham Abdullah said the first 2 cases were the restaurant's foreign workers, aged 26 and 27, who tested positive on August 16. In a statement, Dr. Noor Hisham said the 2 cases were detected from random screenings conducted on eateries located around Kuala Lumpur's city centre. The ministry then traced the close contacts of the 2, which led them to a 42-year-old Malaysian woman who is a customer of the restaurant. She had symptoms of sore throat and headache since August 17 and was admitted to the Sungai Buloh Hospital. The Health DG said a total of 672 individuals have been screened, including 16 employees and 656 customers of the restaurant. So far, only the 3 cases are positive infections linked to this cluster, while another 669 individuals have tested negative. The 3 cases were among the 9 new infections that were reported in Malaysia as at noon on Friday. 3 other cases which were reported in Kedah were linked to the Tawar cluster, currently the biggest active COVID-19 cluster in the country, with a total of 2,733 individuals related to the cluster screened as of Friday. The total of cases under the cluster is now 58 and spanning 3 generations. So far, all patients related to the Tawar cluster have not recovered and are still under treatment at hospitals. The cluster had overtaken the Sivakanga cluster, which has 45 confirmed cases. The index case, patient 9113, a 53-year-old, had tested positive for the virus on August 12. The Malaysian man had a history of attending a funeral gathering on July 31st and August 1st, which was attended by family members. Previously, Dr. Noor Hisham said investigation had shown physical distancing rules were not fully adhered to at the gathering, which contributed to the transmission of infection. The Health DG said there were also 4 imported cases involving non-Malaysians who arrived from the Philippines, Austria, Indonesia and India. 1 local transmission case was detected in Sarawak after a foreigner tested positive for COVID-19 during a screening meant for those exiting the country. Dr. Noor Hisham said the case had no symptoms and is currently being treated at the Sarawak General Hospital. There were no deaths and 12 patients were discharged, which means the country's active cases are down to 179.